National Youth HIV and AIDS Awareness Day is a nationwide observance that calls on people to take action and invest in our young generation, in their health, their education, and their leadership. The first National Youth HIV and AIDS Awareness Day was held on April 10, 2013. This national campaign is a step forward acknowledging and addressing the needs of young people in the HIV and AIDS response. Today, on the third anniversary of National Youth HIV and AIDS Awareness Day, we welcome you to this forum. This forum will serve to educate, mobilize, and rally our communities and leaders to raise awareness around HIV and the impact it has on our most vulnerable population, the youth. The program will highlight the local rates of HIV infection, how we compare to other cities in the United States, and ways to reduce the incidence rate. There's no cure, but 100% prevention. Also, we will have an opportunity to hear a personal testimony from a young adult living positive, her experiences and her journey. The Alliance for LGBTQ Youth has convened a youth panel representative of one of the most affected populations, Black and Latino youth, that identify as LGBTQ to share their experiences of discrimination and the stigma of HIV and AIDS within their community. Throughout this session, we will explore how family, community, and social welfare systems contribute to root causes that lead to prejudice. Root causes of HIV include poverty, lack of sexual health education, unstable housing, the presence of violence, drug and/or alcohol abuse, physical and emotional traumas, social stigmas, and other negative factors that exist in our society. It is these root causes that have a direct relationship with many of the issues that negatively impact our youth: bullying, addictions, irresponsible sexual practices and behaviors, and depression. Addressing these issues will help veer juvenile incarceration, school dropout rates, disease, and mortality. Not tackling these issues from an early beginning can be detrimental to the overall growth and success of families, businesses, and our local communities. So, how big is the problem for youth living in Miami-Dade County? At this time, please welcome Kira Villamizar from the Florida Department of Health in Miami-Dade.
Good afternoon, and thank you for the invite. In such an important day, we would like to give you an overview of the cases in terms of STD cases and HIV cases in our community for youth ages 13 to 24. Thank you. I want to start by giving you an idea of the population in Miami-Dade County. We know that in Miami-Dade County, the population is 2.6 million individuals are living in Miami, the majority of which are Hispanics, followed by Blacks and whites. When you look gender-wise, 49% of the population is male, followed by 51% females. The youth, the target group that we're addressing today, they represent almost 16% of the population in Miami-Dade. The makeup is almost the same for the general population, majority Hispanic, followed by Blacks, and then whites. And then we see that 51% of our youth is males, followed by females. What we want to understand is what is the problem in our community when it comes to STDs and HIV. To understand the problem, we first need to look at results of the 2013 Miami-Dade County, Florida Youth Risk Behavior Survey conducted among high school students. What we found in terms of sexual risk behaviors is that 45% of those students that were interviewed for the purpose of this survey indicated that they had sexual intercourse. 7% had sexual intercourse for the first time before 13 years, before they were 13 years old. 16% had sexual intercourse with 4 or more persons during their lifetime. 32% had sexual intercourse with at least one person during the 3 months before the survey. 34% did not use a condom during the last sexual intercourse. 15% did not use any method to prevent pregnancy during the last intercourse. 21% were never taught in school about HIV or AIDS infection. In terms of alcohol and drug use, what we know is that 22% drank alcohol or used drug before last intercourse, and 2% used needle to inject illegal drugs into their body one or more times during their lifetime. Sexual risk behaviors place adolescents at risk for HIV infection, STDs, and unintended pregnancies. What is important is that all these risk factors is what is leading to the rates that we're gonna share with you now. When you look at HIV infection in Miami-Dade, youth ages 13 to 24 make up 3% of the more than 25,000 people in Miami-Dade that are living with HIV as of 2013. Nearly 48% of new infections in youth are taking place among Latinos or Hispanics, 46% among African Americans, 5% in whites, and less than 1% in other race or ethnicity. When you look at this, the following pie chart, what it's showing you is the number of cases among youth by risk factors. Among our males, 13 to 24, the main risk factor is males that are having sex with males. They make up 68% of the cases, followed by heterosexual contact. Among our females, the main mode of exposure, they are getting infected through heterosexual sex. When you look at, pardon me, oh, sorry, this was the HIV, I apologize, but it's the same. You could see that the main risk of exposure is MSM, followed by, in females, heterosexual. I like to show this particular graph because it talks about trends. What are the trends among our youth in terms of HIV? And this is by race and ethnicity. What you could see here, you could see the red one represents whites in our community, and we look at trends from 2005 to 2014. The numbers remain stable, the same. We don't see increases in this particular group. When you look at blacks in 2005, we had a decrease in the number of cases, then an increase, and it has remained up and down, but the trend is that cases are going down among this particular group. Whereas when you look at Hispanic youth, cases keep on increasing steadily among this particular group. Next one is the number of AIDS cases. There is a difference. There is a difference between HIV and AIDS. HIV is an indication of the new infections, how people are getting infected. AIDS is when the person is already diagnosed with the disease. So what we see in here is that in every ethnic group, in terms of AIDS cases, the cases are going down. The reason behind this is because we are doing a very good job when it comes to testing, identifying those that are infected, linking them to care, and making sure that they remain in care and they get the treatment that they need. HIV is becoming more like a chronic disease. If we take the medication, which is highly effective nowadays, people could live longer with HIV, and it takes longer to develop AIDS. So that's the importance of this graph, that we don't have as many people as we had at the beginning in terms of youth developing AIDS. When we look at the next one, this is in terms of HIV infections among females ages 13 to 24. The main mode of exposure is heterosexual sex, but you could see that the trend is that every year we have less cases among this particular age group. And it could be because of the prevention efforts that we have out there within the schools, what the school is doing, what the community is doing to educate females. We could also see that the next risk factor is injecting drug use is very low, it's been stable throughout the years. Among males, this is one of the slides that is very interesting to me, because when you look at this, what you're gonna notice is that the main mode of exposure is men that are having sex with men. And it keeps on increasing. Here's where we have our numbers. Here's where we need to concentrate our prevention efforts, making sure that we educate our community, our males in the community, our youth, about prevention efforts and what they need to do to ensure that they don't get infected. The next one talks about linkage to care. In 2013, out of the 189 cases diagnosed among this age group, we were able to link to care 85% of those youth. They were seeing their doctor, they were receiving treatment. 15% were not in care. We need to do better. We should be able to have 100% of the kids in care. In 2014, we had a setback. Our numbers went down. 78% were in care. 22% were not in care. And what you're gonna notice, both in 2013 and 2014, is that the majority of the kids that were not in care were Blacks compared to Hispanics. And that's one of the things that we as providers, those that are working not only in terms of prevention but care, we need to do better to engage our kids in care and to make sure that they remain in care. At this point, I'm gonna pass the microphone to Leo Chacon, who's one of our DIS intervention specialists, and he's gonna talk about the STDs.
Thank you. Do you know how many common factors exist in between HIV and STD? Among them, we can mention that HIV and STD, they share the way of transmission, that is well known. Also the risk factors that Kira have been talking. I'm gonna talk more a little bit in the future, during the presentation. But the most important thing about the STD and HIV is to know that a person that is affected for an STD are more likely to get infected with HIV, to pass or receive HIV in any sexual exposure. That's the reason when we try to protect somebody against STD, in some way we are protecting the person against HIV as well. Most of the people that, that are affected with HIV, by STD, they are among a young population. Youth represent teenagers, youth represent a very large portion of the population. For example, during the years 2011 to 2014, we see the STD affect around 11,462 people. We're talking mostly about chlamydia, gonorrhea, and syphilis, because they are the reported STD. We're not talking here about HPV, we're not talking about herpes, genital herpes, we're not talking about other STD, mostly bacterial infection, syphilis, gonorrhea, and chlamydia. Though from those people, 96%, almost 97%, they are among a youth population between 15 and 19 years old. Female accounting for 75% of all reported cases. Probably because one of more common STD is the chlamydia infection that mostly causes symptoms in women and not in males. Probably a lot of males with chlamydia, they don't know they carry the infection. That's the reason we have so many people, females, with that number of diagnosis. Around 39% of the cases occur in Hispanic and Black population. Black population or Hispanic, 20% among Hispanic, and 3% around white. Because Kira was talking the proportion of white, Hispanic, and Black in Miami-Dade population, we can see that how affected is the African-American youth because they some STD. From these cases, 11,462 cases, 81% represent for chlamydia, is caused by chlamydia. I was talking before, 16% by gonorrhea, 1.8% by syphilis, and 0.8% by HIV. Here we can see the proportion of cases during the year 2008 to 2014 by race, ethnicity. for each STD. Syphilis, as you can see, the trend is going down for African American. However, for Hispanic, the trend for syphilis is increasing. More Hispanics have been infected with syphilis during this year. The trend for white is almost the same. The increase is little, but actually white population represents a small part of the people infected with syphilis. In case of the chlamydia, it's different. You see the trend for people with chlamydia among African American youth is vary. Some years has more cases, other years has less cases, but it's almost the proportion is the same. Hispanic, they have been more affected during the years. We find more cases of chlamydia among Hispanic population, and between a white non-Hispanic, we see the trend is almost the same. The cases remain the same. Has been a little bit increasing as a trend, but not that much than other groups. In case of gonorrhea, we see a significant decrease among African American population, which is very important. However, the increase is more significant in Hispanic population. They are more Hispanic. In general, the trend is that Hispanic population are more of all racial and ethnic groups are equally affected for any STD. As you see, the trend is increasing in all of them, but the increase is more significantly among Hispanic and among African American. Any effort that we can target this population group, is going to be effective in the way to prevent the spread, the transmission of STDs in general.
I wanted to talk a little bit about, we have an idea of the problem in terms of HIV and STDs. Now, we want to talk a little bit about what we have done to really address the issue. One of the things that we have done in collaboration with Miami-Dade County Public Schools is we have partnered with the schools in the implementation of the Healthy Teens Expo. This is a health fair that goes to the schools and provide education on STD, HIV, and also allow the kids to have access to STD and HIV screening. In the calendar year 2014-2015, we are targeting 20 priority schools that have been selected by the Miami-Dade County Public Schools based on surveillance data. We have 15 schools that have participated so far, 5 schools are pending, and we have tested 1,447 kids during these events. Thanks God, we haven't found any case of HIV within the school. We have found 15 chlamydia reactive, 4 gonorrhea, and 2 syphilis reactive. One of the things that we're doing as we identify these kids, we make sure that the kids get access to clinics and they get treated for these diseases, because as Leo indicated, all of these diseases, if they go untreated, will have severe consequences for our youth in terms of infertility and things that could happen later on. In the 2013-2014 school year, we targeted 9 schools. We tested at 805. We identified 2 new HIV positive kids infected with HIV, 44 cases of chlamydia, and 12 cases of gonorrhea. All of these kids were also linked to care, so they could receive the treatment for their STDs, and they were linked to care, those that were HIV positive, so they are actually in care at this point. Something else that we have done in terms of increasing awareness and also making sure that people know their status, because this is crucial in terms of preventing this disease, is we have partnered with the county in an initiative called Take the Train, Take the Test. This is a partnership between the Miami-Dade County Health Department and the county government. We go to different train stations throughout the year, and together with our community-based organizations, we offer education, STD, HIV education, as well as testing. So in 2014, we had 12 events, and we tested 576 people. We identified a couple of positives, and we linked them to care. We also have another initiative that is actually is a county initiative that is being funded by the county, executed by the health department, which is Take Control. Again, we go out in the community, different venues, we test for STDs and HIV, and we provide education and information. In 2014, we had 45 events. We tested 1,410 people. And we have been participating with the Miami-Dade County government in an initiative that is called Walking One Stop Events, spearheaded by the county. They go to different districts within the county, and they bring a variety of services. So we have been providing HIV testing and STD testing. Last year, we participated in 9 events, and we conducted 121 tests. This is part of what we are doing to address our epidemic, because critical is to bring the information to the community and to make sure that people get tested for HIV and STD so they know their status. HIV affects everyone, and Leo was talking about, what are the risks for HIV? We know that one of the risks is not knowing the facts about HIV, not knowing our personal risk, having unprotected or risky sex. Every time we have sex without using a condom, we're putting ourselves at risk. Every time we have sex with someone that we don't know the status of that person, we're putting ourselves at risk. Having sex under the influence of alcohol and drugs is another risk factor. Sex with older partners who may be more likely to be infected is another risk factor. Multiple sex partners. And one of the things that we saw in the survey that was conducted within high school students is that some of our youth is having multiple partners. And if they're not using condoms as a protection, that means that they are at high risk of contracting STDs. And one STD could open the door for HIV. Injecting drugs is another risk factor, and STDs, as was indicated before. So what are the solutions to the problem? We have 3 ways of looking at the solutions for the problem that we have in here. At the school level, better health education. And this was cited, again, in the survey, making sure that more students have access to better health education, comprehensive education. That goes beyond the abstinence. We believe abstinence is important, but we also need to be able to provide comprehensive sex education to our youth. So we talk about more comprehensive health services. This is in terms of our youth having access to services within their clinics, making sure that either STD or HIV screening is available in some of our, in the clinics within the schools that have full service clinics. More supportive policies for our LGBTQ youth. More curriculums addressing that particular population. More family involvement, making sure that within the schools, parents and families are educated about HIV and STDs so they could have that communication within their homes with their kids. That is critical. At the individual level, what is important for us is to know the facts about HIV and STD, understand our risks, getting tested for HIVs and STDs, talking to our parents, our doctors, talking to our teachers, trusted adults, any questions that we have related to HIV and STD. Resisting peer pressure and making sure that we don't exert pressure on our friends or our peers to have sex. Sexually active youth can reduce their risk by choosing to stop having sex. If they decide to have sex, they need to use a condom. They need to make sure that they don't have multiple partners. And usually we talk about not having sex with older adults. That could be another way of reducing our risk. At the community level, we're talking about, again, getting to know the facts, getting information, getting tested. If we know that they're infected, getting into treatment. We talk about engaging in community and web-based education, and more importantly, regardless of whether we're youth, adults, or the general population, we need to work together to fight stigma in our community. That's one of the main factors why our community is not getting tested. Our community is not accessing treatment because of the stigma that we have in regards to this disease. So that's one of the things that we need to come together. We need to educate our community and combat stigma, making sure that we fight stigma in our community. That concludes our presentation in terms of the numbers in Miami, what we have done, and what are some of the solutions. Do we have any questions? No? Thank you very much.